Hi, I'm Dr. Cangello, and I wanted to discuss a little bit with you the different types of breast implants that are available on the market, and also give you some insight as to how I choose the type of implant that I use for my patients most frequently. There's a lot of names of implants that people are familiar with. However, it's sort of difficult for them to understand which implant is which, so I'm going to help demystify that here in this video. The first implant that I want to show you is the implant that I use 99% of the time in my practice. This is a round silicone gel-filled breast implant. The reason I like it the most is because I think it feels the most natural, and it appears the most natural. Another type of implant is this. This is a traditional saline-filled implant. You have a silicone or plastic shell here. We insert a little port when it's in the breast implant pocket. We fill this with saline and then remove the port, and this is what's left inside the patient. The reason this has fallen out of favor is because it's not as natural feeling or appearing as the round silicone gel-filled implant. In addition, it's a little bit more prone to rippling, which is when the breast has sort of those ridges on the side, the indentation, so it's more prone to rippling than the silicone gel-filled implant. Another type of implant, this is the ideal implant. It's also saline filled, but it's different than the other one I showed you because it has two lumens, so two sections of this implant that are filled separately with saline. And the company who made this implant because they wanted a saline filled implant that was as natural feeling as a silicone gel filled implant. I'm not so sure that that's the case. I still think that the silicone gel-filled implants are the most natural feeling, and for that reason, that's still my go-to implant. Lastly is this type of implant, and there are three terms that are commonly used interchangeably for this implant. One is the gummy bear, another is anatomic, and last is the teardrop shape. All of those descriptors are meant to refer to this particular implant, and the reason it's called anatomic is because it has a firmer gel, which when you lay this flat, the firmer gel keeps the fullness in the lower pole of the breast. So when it's upright, when a patient will be standing, you see that the fullness is really in the lower pole and it's less full in the upper pole. I personally think the downsides to this implant are that because the gel is firmer so that it doesn't migrate, it can make the breast feel a little bit firmer. In addition to that, if the implant rotates within the breast pocket, you then have to have another operation to fix the orientation. Again, if you look back at this implant, when this one is held upright in a patient, the gel is less cohesive. And I'm sorry, that's one more term for the other type of implant, which is cohesive implants. But the gel here is less cohesive, so it can migrate to the bottom so that you get the fullness in the lower pole and the upper pole is thinner. So this looks just as natural as the anatomically shaped implants, yet it's softer, and if it rotates, you don't have a problem. So hopefully I've helped you understand the different types of implants, how I choose what I do. Again, I choose to use the silicone gel filled 99% of the time. However, I'm open to using whatever sort of implant the patient wants. And if patients do have an aversion to silicone gel filled implants, there are certainly two options, and we do use both of them. Thank you.